Hi, Brittany. Thank you for coming in to see me today. I know that I've talked to you before, and I just want to let you know I'm going to be starting a new interpersonal group therapy next month. And I'm screening some of my clients to see if they would fit the criteria to be in that group. So if you can just give me a little bit more background about you and your substance use.
Yeah, so I've been having a hard time. Um, in the past, I've had a drinking problem, and I've been using Xanax. And I am ready this time. I want to stop for my son, for my family. Just want to have a normal life.
Okay, I understand that. It's a completely understandable goal. Since you're kind of used to the one-on-one therapy, and this is kind of a new group, I have some questions I'd like to ask. I have there's about 8 or 9 of them. So my first one is I want to know how you feel about sharing your feelings and your story with others. And if you are uncomfortable sharing, how open would you be to try?
I would be comfortable sharing. I think I'm ready to take that next step. I think hearing other people's stories and what they've been through will kind of help me feel um, more supportive and kind of feel better that there's other people who are going through the same struggle as me.
And we get that a lot of feedback from that with the group therapies that we do, that people enjoy talking to people who have gone through the same thing. So it's very good that you said that. My next question is, how well do you think you'll be able to handle other people contributing to the conversation?
Um, I think um, I will try to relate
Mhm.
um, and kind of maybe get some ideas or advice on how they dealt with their problems. So that would kind of help me maybe deal with my future problems too.
And then kind of building off of that a little bit, there's often comes up times where people in the group will have differing opinions on things. So coming off of that last question, how comfortable would you be sharing your own opinion on things with other individuals in the group?
I will try to definitely keep uh, a judgment free opinion. I'll try not to be disrespectful. Um, I will try. I will give my opinion if people are open to listen to it, but I'd be respectful about it.
So you would ultimately you would give your opinion, but you would also be respectful of others' opinions as
Yes,
well.
yes.
Okay. So then coming off of that, how open are you to the idea of just overall group therapy? Because I know for some people it can be kind of hard for them to go from an independent, like one-on-one, to a group.
Um, I think each group session will probably get easier and easier. I think the first one might be hard. Maybe it'll be hard for me to open up. I'd probably just listen in for the first one and then just see how it goes. Hopefully, I'll
Yeah.
be more comfortable with each one.
And that's what I've seen too happen with others. They just kind of watch and learn the first few times. And then as they get more comfortable, they become more of an integrated part of the group. And also in this group, recovery and abstaining from substances is of high importance to all of the members. Um, so I just wanted to ask you, on a scale of 1 to 10, 1 being that it's not important to you at all, and 10 being that it's the most important thing, how important is it for you to abstain from substances?
Right now, it's a 10. I would say it's the most important thing in my life. So I'm very ready for this.
Mhm. And then when it comes to, we also talk about when coming to group therapy, we look at your stage of recovery and where you kind of lie on your treatment path towards your goals. So when it comes to your stage of recovery, how would you think you would categorize yourself? Either early stages, middle stages, or late stages, and just maintaining coping strategies?
I'm kind of in the middle stages, I
Okay.
would say, yes.
So you think you're definitely not in those early stages. You can have some, you're not at the maintenance stage yet, but you're still open to learning new things and
Yes,
learning from others.
exactly. Yes.
And then what do you personally think you can contribute to the group that would benefit all the parties involved? Any good characteristics or anything like that?
Um, I think I'm patient. I'm a good listener, I've been told. Um, from my experience, I could give advice to those who are just newly relapsing, because this has happened to me a few times.
Mhm.
So I'd say experience is definitely a big thing.
Can you build a little bit more on the relapsing part? Because that is a big part of the recovery process. A lot of the group members have relapsed. So how would you kind of relate to that with them?
I think it's definitely a tough thing to go through, because you come so far and then to just start all over again, it's very, very difficult. So I think this program could be very beneficial to me, because it'll be something different I haven't tried before.
Mhm. Okay. And then the last question is kind of about like your person. So do you tend to compare yourself to others, or are you more of your own person? Are you more of an independent kind of person?
Um, I've I'd say I've become a more independent person. Um, I think I've grown a lot. Yeah.
Okay, so basically, what I've gotten from you is that you feel as if you're in the middle stages of treatment. You're very dedicated, or seem very dedicated to abstaining from substances and listing it as a top priority. So I really do think that you would be a good fit for this group because from what you've told me, you're an open person. You are open to hearing what others have to say, even if it's just them offering their opinion. And that's something that's really, really big in our groups is being open-minded towards the other members because these people have all gone through the same thing. So it's really beneficial to each and every individual when everyone has an open mind. So I think that you would be a good fit for the group. So I was just curious how you felt about that.
I'm very excited because, like I said, that I've not tried this before. I've always done a one-to-one. So I hope this, I'm going to try to be the best possible, and hopefully this is something long-term for me and this works out.
Well, I'm really excited for you to join our group that's starting next month, and I hope that you're excited too.
Thank you so much.
Thank you.